So good afternoon. Yesterday, the Department of Public Health reported 2,463 new COVID cases in Massachusetts on 43,304 new tests. In total, we have now crossed the 9 million tests conducted in Massachusetts statewide. The 7-day average positivity rate is 5.5%, and statewide, just about 1,500 people are in the hospital and about 300 are in the ICU. Since Thanksgiving, the Commonwealth has experienced a rapid increase in new infections and hospitalizations. Significantly, more people are suffering from severe COVID-related illnesses, and they do need urgent care. And this sharp increase is putting a strain on our healthcare system and on our frontline healthcare workers. Over the last 4 weeks, confirmed COVID hospitalizations have increased by about 150%, and confirmed cases in the ICU have increased by about 110%. 11 hospitals across the state are now reporting fewer than 10% of adult inpatient beds open and available. The Commonwealth's ICU beds are occupied at a rate of about 63%, meaning only a little over a third of our hospital system's beds are not currently filled. The rate that people are becoming ill and needing serious medical attention has certainly increased, and this comes at a time when hospitals are short on critical staff because many are in quarantine because they've been exposed to somebody who tested positive or they themselves have been infected with the virus. As we discussed yesterday, hospitals will curtail elective procedures in response to all this that can be safely postponed starting Friday. That will free up staffing and beds. And the state's also standing up 2 field hospitals for extra capacity. The field hospital at the DCU Center in Worcester has started to accept patients, and another location is currently being stood up in Lowell. But the rate Massachusetts residents are getting infected and the rate at which they are needing medical care, if all continues to move at this pace, is simply not sustainable over time, and our healthcare system will be put at risk. We learned a lot about COVID back in the spring, and we learned, among other things, that everybody has the ability to stop the spread. Wearing masks, staying home, avoiding informal social gatherings, distancing, good hygiene. Those should be, by this point, pretty familiar words to most people here in the Commonwealth. We've also talked about the fact that the virus is always there somewhere. It doesn't discriminate, doesn't take days off, and in many cases, people who carry it and transmit it either have very light symptoms or no symptoms at all, making it truly a secret and silent spread. We know it can wreak havoc on people with pre-existing health conditions and on the elderly, and in some cases, it is, in fact, deadly. We've asked businesses and their employees to sacrifice tremendously throughout the course of this pandemic. And we asked every resident of the Commonwealth to change their behavior, and in many cases their lives, so that we could stop the spread of COVID. And we had some very hard and very dark days. Our hospitals, in many cases, almost shut down except for the life-saving care they were providing to meet the tidal wave of infected patients. But we got through it. We slowed the spread, people rallied, we managed to reopen our economy without creating a new source of spread, and built an army of resources to make it possible to fight the virus. But we are still in a pandemic, and the state of Massachusetts is being tested once again. About a month ago, we tightened restrictions and reissued several advisories in response to a surge in cases. This included reissuing the stay-at-home advisory between 10 p.m. and 5 a.m., while we strengthened our public health orders requiring people to wear a mask all the time, and early closures were put in place for many businesses. And before and just after Thanksgiving, our public health data was showing progress from those restrictions. We saw case growth stabilize for about 10 days. People in Massachusetts responded, and we were grateful to everyone for doing their part. But here we are today, 12 days past Thanksgiving, and new infections and hospitalizations are showing disturbing trends. Once again, our healthcare workers and our healthcare system are being put at risk as the case count continues to rise. The days of most people doing most of the right things are probably not enough. And we're asking everyone to join us to step up their vigilance every day, in every setting, work, home, school, everywhere. There's no question that hope's on the horizon. The vaccine is on the way, and there are many treatments that are now game changers for people who are dealing with this terrible disease. But we cannot simply wait for the vaccine to get here. We've gone through great lengths over the course of the past 10 months to issue guidance across the formal parts of our economy to keep workplaces operating safely and customers safe. We've issued some of the most aggressive public health orders in the country around business operations and other public health orders to require masks, distancing, and other safe practices. And we built the most comprehensive testing infrastructure in the country. We are certainly in a different position than we were in last spring. But with our hospital system straining to keep up with the sharp increase in severely ill patients, we have to do more. And effective this Sunday, the Commonwealth will move every community in Massachusetts back to Phase 3, Step 1. This will reduce indoor capacities across a broad range of sectors of the economy and tighten several other workplace restrictions. The move back to Step 1 will also require the closure of certain businesses that are designated as Step 2 industries. These include indoor performance venues and certain high-contact indoor recreational businesses. In addition to closing the indoor recreational businesses in Phase 3, Step 2, we're also reducing capacity limits to 40% statewide for pretty much everything else. This includes gyms, libraries, museums, retail, offices, places of worship, movie theaters, lodging, and more sectors that the Lieutenant Governor will go over in detail in a minute. The rollback to Step 1 will also automatically reduce the maximum size for outdoor gatherings from 100 people to 50 across all communities. These new measures are designed to do three things. Number one, prevent infection and viral spread, especially in indoor settings. Number two, to create stronger mask compliance, more social distancing, and limits on the time spent with people outside of your immediate household. And step three, to reduce mobility. Massachusetts is actually, by most national measures, a pretty strong performer on the reduction in mobility that's taken place since last February. We're still about 30% below where we were before the pandemic began. But clearly, we need to do more, and that's not enough. And today's announcement also includes strengthened guidance for masks in certain locations and activities, including gyms, office spaces, and restaurants. Restaurants will also be required to reduce table size from 10 people to 6 per party and must set 90-minute time limits for dining. Some restaurants are already following these guidelines, and we believe it would be appropriate for the rest to do the same. Lieutenant Governor will provide more detail on this guidance shortly, but again, these changes go into effect on Sunday. We're going to continue to be as aggressive as we can in fighting the virus, but actually there's nothing more powerful than people playing their part and understanding their role. We've watched you all listen and rally and fight successfully to beat this thing back before. And the people of Massachusetts have put up with a lot. The sacrifices, the list is endless. But as I said before, there is hope on the horizon, but we need to work really hard to get from where we are to there, and to do so in a way that preserves our healthcare system, protects life, and makes it possible for people to continue to be able to do those essential things that relate especially to work. Wear a mask when you're around anyone who's not a member of your immediate household. I've had my own friends say to me that this concept that their friends are a problem for them is an extremely hard one for them to understand. And then I got a call last weekend from a friend of mine who said she and her husband had made plans to go have dinner outdoors with some old friends of theirs that they hadn't seen in a long time at a restaurant that had covered, heated outdoor seating. Long story short, the restaurant was unable to accommodate that reservation, and they offered them indoor seating. The other couple that my friend and her husband were going to see said they'd be perfectly happy to take an indoor seat. And my friend said, you know what, we haven't seen you guys for a long time. We'd love to see you, but we're going to pass. She has particular issues that make her nervous about getting the virus herself. The other couple was angry and gave them a lot of what for about why they were being so silly with respect to the way they were dealing with this issue. And then 5 days later, they both tested positive for COVID. And my friend felt pretty good about the decision that she made. I tell you that story because it was not an easy decision for her. These were people that she'd known since she was in high school. She hasn't seen them for months. There aren't going to be that many more opportunities to eat outdoors in Massachusetts for quite a while. And in some ways, the easiest thing to do would have been to say yes. But she heeded the guidance from us and from others that said you really shouldn't be spending a lot of time indoors with people you don't spend time with, live with, on a regular basis. And she got grief for that. But in the end, she made the right decision. We're social people. We miss our friends. We get it. It's true for all of us. And there's no question that some of the decisions that we're making today that will become effective this weekend will create hardship and difficulty for many small businesses and their families, which is why these decisions are hard. And for those of us who appreciate how hard these decisions can be, especially for the people who are directly impacted by them, I have a really simple message. Try to take advantage of the guidance. Don't spend a lot of time in indoor spaces with people you don't live with. Don't go to a friend or a neighbor's house without a mask on and share food and drink just because they're your friend. recognize and understand that these issues around masks and distance and household bubbles, especially when there's community transmission, and all kinds of people you would never expect would get this virus are getting it, are the best protection for you and your family in dealing with this issue, and it's also the best way to help us deal with the spread that is now impacting our healthcare system, our hospitals, and creating difficulty for our economy and for the people who work in it as well. We are in the middle of the holiday season. We all get the fact that that's a tough time of year for this kind of a message. But now more than ever, as we all work our way through this second surge, it's critically important for everybody to understand that the decisions you make every day about what to do and who to be with will have a significant impact on our ability to stop the spread, to make it possible for people to work, to keep our schools open for kids, and to build ourselves a bridge to the vaccine and keep our healthcare system strong. With that, I will turn it over to the Lieutenant Governor.
Good afternoon, and thank you, Governor. As we've discussed, we are in a second surge of COVID-19. People across our state in every corner of our Commonwealth have been working so hard to fight this virus. And we are grateful for the cooperation and the creativity of the many businesses that make up our main streets and downtowns to help us stay safe, to protect our workforce and consumers alike. And as we approach the holidays, this is one of the busiest and treasured times of year, especially for small businesses in the hospitality industry. And we know this has been incredibly challenging, and it won't be the same. As the Governor said, cases and hospitalizations have recently been increasing statewide, and we must preserve our hospital system's ability to provide life-saving care for everyone who needs it. Today's announcement is meant to tighten up guidance and to ensure that all residents are taking the proper COVID-19 prevention measures no matter where they are. We cannot stress enough that all residents need to keep up their guard, wear a mask, social distance, and avoid groups, as the Governor has repeatedly messaged throughout this pandemic. By increasing mask compliance, encouraging more distancing, and lowering activity, we can stop the spread when the people of Massachusetts will just dig deeper and work harder together. We've proven we can stop the spread of COVID-19, and I'm certain that our residents can and will rise to the occasion once again. We are in a second surge. This is a very serious time, but we are very hopeful that vaccines are in our sights so we can soon restore the full vibrance of our great state and our quality of life. Here are a few more details on today's announcement. Effective this Sunday, we will implement a statewide rollback to Phase 3, Step 1. This is being done in order to reduce the opportunities this virus can have to spread. The rollback will have a number of immediate effects that will apply uniformly to all municipalities across our state. The gathering limits for all outdoor event venues and outdoor spaces will be reduced from 100 to 50 people for outdoor events at event venues in every municipality. People hosting gatherings greater than 25 people outdoors will now be responsible for notifying their local Board of Health. This is an adjustment from previous guidance requiring a notification for outdoor gatherings that are greater than 50 people. And just to great thank you to all the local boards of health and all that they are doing every day in their communities to enforce the safety protocols, help businesses and people comply. They've done an incredible effort, and I know we're asking the local boards of health to do even more as our partners. Indoor theaters, performance venues, and a few smaller indoor recreation businesses will also be required to close with the rollback to Step 1, Phase 3. We are hoping that this will be a temporary closure and that when hospitalizations and public health data stabilizes, we can consider reopening. Outdoor theaters and venues will be limited to a capacity of 25% with no more than 50 people. Other sectors, including arcades, certain recreational businesses, driving and flight schools, gyms and health clubs, libraries and museums, will operate with a reduced allowance of 40% capacity in all communities. Retail stores, office spaces, places of worship, movie theaters, and common areas and lodging facilities will remain open, but will be required to operate at 40% capacity, allowing for greater distancing. With regard to our restaurants, we've asked a lot of our restaurant owners and operators across our state all throughout this pandemic. And as we know, social settings where people are unmasked have been a challenge. The restaurant community has gone to great lengths to enact safety protocols from partitions to outdoor dining, and has done a great job operating safely. They've been creative, they've been innovative, and they've really worked hard to make people feel safe coming in and out of their establishments, and most importantly, to allow their workers to feel safe, providing the services in their restaurants day in and day out. But as the governor said, it's important that we keep striving to use every prevention strategy that we have and that we know of to fight COVID-19. In order to improve safety at restaurants for patrons and staff, patrons will no longer be allowed to remove masks as soon as they are seated. Masks must be worn at all times unless eating or drinking. So this allows the server to be masked and the patron to be masked, for instance, when ordering your meal, to protect both parties. In addition, table sizes will be reduced from 10 guests so that no more than 6 people will be seated per table. We also urge patrons to dine only with people in their own household to reduce the risk of transmission. All tables at restaurants will have a 90-minute time limit. We've seen some clusters associated with social clubs, and these clubs are reminded that they must follow the restaurant rules if they are providing food service. Musical performances will no longer be allowed in restaurants, and food court seating will be closed in malls. In gyms and fitness centers, masks will now be required at all times. For office workers, our rules for mask wearing will be adjusted to require all office workers to wear masks. Workers must wear face coverings at all times except when within their own individual workspace and alone, or where a medical condition or disability makes wearing a face covering unsafe. Face coverings will be required for all workers and guests in all common areas and in meeting rooms, even when 6 feet of distance can be maintained. We are also encouraging employers to close or limit use of break rooms where workers may congregate. Employers, if possible, please allow your workers to continue teleworking as we've continued to see spread in the workplace. These restrictions today are targeted ways we can fight back against the second surge of the virus. I urge the public and all industries to take this seriously so that we can keep our businesses open and our economy running. And in order to beat this virus, we must all continue to do our part. This isn't easy, but Massachusetts residents will do what they've done time and time again: protect our state and protect each other by being smart, vigilant, and dedicated to fighting COVID-19. There is a light at the end of this tunnel. Feels different than when we were at the beginning of this pandemic, especially with the vaccine, which over a relatively short period of time has been discovered, manufactured, and soon distributed here in our Commonwealth. And as we see this light at the end of the tunnel and feel much more hopeful about the upcoming weeks. We must continue to follow these measures and hold ourselves accountable so that we can protect not only ourselves, but protect the others that we come in contact with. Before I turn it over to Secretary Keneally, I just want to say that as we move forward in implementing these new restrictions, which we hope are temporary, I am confident that the people in our Commonwealth will do their part. We've seen it firsthand. We've seen it from emergency responders. We've seen it from our grocery workers. We've seen it in our hospitals. We see it every single day. Many people choosing to do the right thing. And we appreciate that. We are so grateful. And we know, though, at this particular time, we were all hoping not to see a second surge, but this is what we have. And we need to get through it. We will do so together if we continue to do our part. Thank you to the businesses for doing your part, and we appreciate and are grateful for everything that everyone is doing. Let's just dig in deeper and get through this together. Thank you. I'd now like to turn it over to Secretary Keneally.
Well, thank you, Governor, Lieutenant Governor. You know, the vast majority of our businesses have demonstrated an incredible commitment to the protocols and guidance we released since reopening began back in May. These standards have been designed to protect workers and customers and to stop the spread of COVID-19 while allowing commerce to proceed safely. We're proud of this commitment, as well as the patience and understanding of the small retailers, restaurants, and other businesses that give our cities and towns the character we all love. You have installed partitions, added signage, put out hand sanitizer, and ensured safe distancing. You've adjusted, and we thank you all for all you've done and the work you've put in. Your dedication was shown in our success over the spring and summer in our ability to methodically reopen the state's economy. And it's one reason we've been able to begin to transition from reopening to recovery, including the announcement of a comprehensive economic recovery plan back in October. Unfortunately, the predicted second surge is upon us, and we must move quickly to stop the spread. A new normal is still in front of us, but we are not there yet. The new adjustments that the Lieutenant Governor described are designed to do just that, while recognizing that we're in a very different place than we were in the spring. These new restrictions will be difficult, but as we have done before, we will continue to rally as a Commonwealth. One way to do that is to support your local businesses. Perhaps you've seen the My Local MA commercial. This ad was filmed right here in Massachusetts, and it features some of our great retailers and restaurants. The pandemic has forced many businesses on our main streets and in our downtowns to change how they operate. This holiday season, if you visit them in person, please wear a mask, maintain distance, and follow the latest guidance. Or find these businesses online or give them a call to find out how you can, as we say, put your money where your heart is by shopping local. This virus is dangerous and the surge is real, but our residents are determined and our small businesses are resilient. While our resolve is being tested, it remains strong. We will get through this. Thank you. And now, Secretary Sutters.
Governor, Lieutenant Governor, Mr. Secretary, good afternoon. Yesterday, we announced that effective Friday, December 11th, hospitals will cease non-essential elective procedures and treatments that impact inpatient capacity and have the ability to redeploy staff. I would like to reemphasize some of the key points of that guidance. This limited curtailment of elective procedures does not apply to the cancellation or delay of life-sustaining treatment or treatments that would adversely impact a patient's health. The updated guidelines are aimed to preserve our inpatient capacity and to promote the redeployment of staff to support essential and urgent medical care. To further clarify, a non-essential elective procedure is defined as a procedure that is scheduled in advance because the procedure does not involve a medical emergency and where delay will not be adverse to the patient's health. What will continue to be available are priority preventive visits that lead to high risk if deferred. Some examples, these are just examples, so including but not limited to preventive care appointments, including immunizations such as mammograms, colonoscopies, cervical cancer screenings in high-risk groups, children's pediatric checkups, placement of implantable contraception, and prenatal care. If you have a question about an upcoming appointment, please contact your healthcare provider for clarification and assistance. Additionally, we continue to recruit staff for our 2 field hospitals in Worcester and Lowell. I am particularly calling out to part-time healthcare providers, retired medical staff, and others. It is important work, and if you have the skills, ability, and time to work in a field hospital, we need you. We urge advanced practitioners, RNs, certified nurses assistants, doctors, pharmacists, pharmacy techs, respiratory therapists, social workers, and observation assistants to apply for these positions. Please visit umassmemorialresponds.com or lowellgeneralresponds.com to apply for the many jobs that need to be filled in Worcester and at the field site coming online in Lowell later this month. Finally, I'd like to take a moment to remind all of us of the few simple things we can do to keep ourselves, our loved ones, and our communities safe. Wear a mask, wash your hands, keep your distance, and avoid groups. Thank you. With that, I'll turn it back to the Governor.
Questions?
Governor, if it is taking effect on Sunday, do you think this comes too late?
We basically followed the data after Thanksgiving and said from the beginning that we were going to wait till we saw a few days' worth of information. And as I said in my remarks, the first few days after Thanksgiving continued the trend that we'd seen before, which had been a flattening out of what had been sort of day-over-day increases. Once we saw the numbers move for several days, we started discussing with our colleagues in local government, the folks at the command center, and others, what types of measures would make the most sense to implement on top of the stuff we put in back at the beginning of November. And this is the result of those conversations. And I certainly hope that people not only take these to heart, but also the other messages about what we all do as individuals, because those are every bit as important as the guidance.
What impact do you think it would have on indoor gatherings, especially just a couple weeks out from Christmas?
You know, it's pretty clear that the traveling levels across Massachusetts and in most of New England were way down from where they were in previous years. The downside to that is we still ended up exactly 5 to 7 days after Thanksgiving with significant increases in cases, which I think most people believe in the public health world came about as a result of a lot of the gatherings that took place over the Thanksgiving Day weekend. I can't express how important it is for people to recognize and understand that it's everybody's activity here that matters. And that's especially true when you get to the point where you do have pretty intense community spread across your Commonwealth, which is where we sit now. And the numbers with respect to both hospitalizations and case growth should be all the indicator that people need to recognize and understand how important it is for them to take their opportunity to help us manage the spread seriously and dramatically scale back what would normally be a traditional holiday season. In some respects, I guess what I would say is that this is critically important, not just because we're entering into this significant surge, but it's also important because there are so many people who rely on and depend on the rest of our healthcare system every single day. And we should want to do all we can to make sure that they stay as affirmative as they possibly can be with respect to take care of all the other people who have issues in healthcare.
Governor,
Yeah.
you know, the anecdote that you shared about your friend focused on the dangers of indoor dining, and yet the changes you're announcing today don't include, an outright ending or temporary ban on indoor dining. Why not? And then relatedly, would it be easier to take more drastic steps like that if Congress were ready with, more aid? Is that weighed into your decision making about how aggressive, as you say, to roll things back?
Yeah, the first part of your question, I would say that anybody who's been in a restaurant in the past 8 months knows it's a totally different experience than it was before, and that's a good thing. And the point behind my anecdote was much more about this issue of spending time with people you don't normally spend time with, because you don't know where they've been or who they've been with or what they've been up to. I apologize if I didn't make that clear in my story. That, to me, by far, is the biggest part of that story. Because whether you're going to visit somebody in their home, whether you're going to visit them in a public place, whether you're going to visit them anywhere that's indoors with a whole bunch of other people, you run the same risk. This is exactly, by the way, what we saw in the hockey cluster that we came and presented to all of you about a month and a half ago on. That hockey cluster was not actually driven fundamentally by the fact that kids were playing hockey. It was driven by the fact that a lot of kids and a lot of adults were spending a lot of time with each other without masks, without distance, sharing food, sharing drink for long periods of time, both indoors and out at these tournaments. A big part of this is about behavior, and it's not just about the site. Oh, the second part of the question. I've been urging my colleagues in Washington for quite a while now to recognize and understand how important it would be for all of their constituents to come together on a plan that either looks like or is an extension of the CARES Act that was passed last spring. Because that thing made an enormous difference in helping all of us work our way through the first surge. And the two simplest examples I can give you of why that's so important, one of the things they did in the first surge was they created an unemployment assistance program for gig workers, of which we all know is a much bigger part of our economy than it used to be. People who work on their own, people who don't participate in the traditional employer-employee relationship, people who don't pay in to the traditional UI system, who for no fault of their own lost their job or their ability to work because of the issues associated with the pandemic and a lot of the changes and orders that were issued by folks like us and many others. You gonna be finished? The UI program, the PUA program, ends on the 31st of December. It ends. So unless that thing gets extended, there will not be an unemployment assistance program in the United States for a whole bunch of folks who, through no fault of their own, are not able to work. That's point number one. Point number two, the traditional UI program, for many people who participate in the traditional program, will also end on the 31st of December. Those are really important issues when you're thinking and talking about what you're going to do with respect to people's access to work.
Governor, if this doesn't work, how long will you wait before you make the restrictions even tighter? And then also, is there a trigger for when you could reopen things? How much better do things have to get?
I mean, we've generally speaking tried to follow the data what we've said mostly is we follow the data every day, but we don't make decisions based on a couple of days worth of data. And our typical message on this has been, that we think typically 3 weeks worth of data is where you get the definition of a trend. In this particular case, we moved more quickly than that because the adjustment in what we consider to sort of be the baseline on new cases within that 7-day mark after Thanksgiving moves so quickly. I guess what I would say is that we typically want to see at least a few weeks worth of information before we make additional decisions in any direction.
You made it sound pretty dire, though, with the hospital beds filling up, so I'm just wondering, a lot of the public health experts say we can't wait 3 weeks to find out if this works or not, so I'm wondering if people move quicker to...
Well, that was the whole reason, but that was the main reason why we did the decision with respect to elective procedures with our colleagues in the hospital system. That'll free up a significant number of beds. I mean, there are many thousands of beds in Massachusetts that are currently being used for elective procedures.
Governor, we talked about it before. Obviously, a lot of people say this is enough. A lot of people say this is too much. Can you just give the public a general sense of how complicated is it to figure out which restrictions are going to do the right thing versus letting businesses survive, especially around Christmas time and stuff like that? How do you weight that, and why do you think this will work versus the messaging you've been giving us for the last 8 months?
Well, most of the time when we change the rules, and I've said this since March, it does have an impact on what people do and how they behave because most people are in fact rule followers. Part of the reason why the elements that we just rolled back from phase 2, step 3 to, step 2, phase 3 to step 1, phase 3 was because they were among the things that we considered to be the most difficult to create guidance for around managing spread. And some of the issues with respect to gyms and mask wearing in restaurants and time limits and all the rest comes from some of the contact tracing work, and the rationale behind the rules at social clubs were quite similar, which is that time spent is clearly a significant issue in indoor environments generally.
Governor, what target businesses, when you yourself have said that that's not really where the spread is, as opposed to households?
Well, many of the businesses that will be affected by this are in what I would describe as sort of the entertainment space. And that doesn't make me feel any better about it, but they happen to be businesses where there's a significant amount of contact by virtue of the nature of what you're doing. And I think for us, if the goal here is to reduce contact and to reduce mobility, and try at the same time to do it in a way that limits the impact on the economy generally, those are the kinds of places you would go. The sorts of places that were the last places, based on the guidance we were getting from the folks in the public health world about opening in the first place, would be the first place you would go if you were looking to take a step back.
Governor, you have had some criticism from some noted public health experts. One of them from Brown University, who's in the media a lot, has said he was really with you on how you handled COVID when he was a man, and then was aghast at your lack of action over the last 4 to 6 weeks. Would you care to respond to that? And I think everybody knows these are very tough decisions, and you're trying to weigh health versus business.
Look, I have never thought that any of the decisions that we've made since this thing began were going to make everybody happy. In many cases, I thought they would make far less than anybody happy. And I think especially when it comes to the decisions around closing the economy, we need to remember that in the spring, part of the reason we shut everything down was because we had no rules and no guidance and no advisory about work at all. And we felt it was incumbent on us to just stop. Now, that had a calamitous impact on people who didn't have MBAs or MPHs or the ability to do their job from home, or were white-collar workers or worked in finance or accounting or law. The people who really got creamed by that or the people who actually have to get up and go to work somewhere? And I think a lot about that when I think about these decisions. And I also think about it a lot when I think about personal behavior. I think about all those social workers who continued to go knock on doors in the middle of the pandemic. These decisions might seem easy to some people who don't have to live with them, but they don't feel that easy to the people that do. And we should never forget that.
Governor, many communities never really move to step 2 of phase 3, big state. So basically, they're staying put. Would you encourage leaders in those towns, cities and towns, to maybe consider on their own rolling back into phase 2? They can do that, can't they?
Yeah, they can. I mean, look, we've said all along that locals can make decisions. If they think the data on the ground justifies doing more than something we've proposed, they should feel free to do that. And we talk to them all the time about this stuff. What I would say is that in some cases, some of them demonstrated to us through some of the conversations we had that by not going to step 2, they saw some benefit in that. And that was important in the way we thought about whether or not some of this would work. There are also some additional guidance associated with a number of these elements on top of the move to step 1 that we're going to be expecting people to implement, like the six people at a table, like the 90-minute limit, and some of those other initiatives. Those will be additive to what we are proposing.
Governor, as the number of eviction filings increase, or at least initial filings increase, is there any thought about either some sort of return to a moratorium or moving forward with some of the provisions in the budget that's been sent to you?
So we're still looking at the provisions in the budget. You'll hear more about that by the end of the week.
Are there any concerns, I'm sorry, about a possible return to a moratorium, balancing possible impact of people losing work again, but also
Yeah.
federal government's, federal judges' previous?
We have a lot of resources we can put to work at this point, a lot. We have all the money that we put on the table when we put our original proposal together about 6 weeks ago, and there's a lot of additional money that the legislature added on top of that to support landlords and tenants that's part of that budget. And I think from our point of view, we're in a pretty good place to help people at this point and have started to execute on that.
Governor, when a vaccine is available to you, will you take it and will you do so publicly as a sign of safety?
So I have zero interest in cutting the line, okay? I'm not 65, I'm 64, right? So, but as soon as I am able to get the vaccine, whenever that happens, yeah, I'm going to be one of the first in line to get it then. But there are a lot of people who are going to be in front of me, and I would much rather see us focus on them at the beginning. We're going to have a lot more to say about vaccines tomorrow, and we're going to bring some people with us who've been part of our advisory board and our conversations about what our distribution plan will look like.
Anything hopeful to say about the news that we're hearing today? Anything hopeful?
Yes. Whoever asked that question, the answer is yes. We have a ton of PPE.
Governor, anything?
We have enough to last through next year.
Anything hopeful as people listen to this news today? From your discussion with all the doctors we're going to do tomorrow?
Look, I think for me, the most important message about hope is pretty simple, which is the people of Massachusetts, all the way through the spring and into the summer, proved that when their backs up against the wall, they will find a way to do what's best for them and their neighbors and their coworkers. And I have no doubt that they will do that again. But it needs to be a different kind of holiday season than it's been previously. But that's an important part of getting walking the bridge that gets us from here to the vaccine in 2021. Thanks.
Thanks, everybody.